Welcome to the Protect Your Back class. My name is Felipe Cáceres, staff physical therapist at Zuckerberg San Francisco General Hospital, and together with my colleague Kevin Sullivan, we will cover what is back pain, strategies to protect your back, and exercises you can do to help alleviate back pain. Back pain occurs in 80% of the population at some point in their lives. Many go to women, normally acute, which means it's short term, lasting from days to weeks, and resolves on its own with basic self-care. There are different types of pain, including dull, a constant ache, a sharp sensation, cold or hot sensation, an electric sensation, and numbness and tingling. It can come all of a sudden, out of nowhere, or it can actually come gradually and over time. Most of the pain is acute, which, like I stated earlier, it lasts from days to weeks and normally resolves on its own. But I imagine if you're listening to this class at the moment, you might be in the more chronic category, which lasts 12 weeks or longer, and it can still take longer to actually resolve. Most of the causes of back pain are of a mechanical nature, meaning one or more parts of the back are not working correctly together, which can lead to the sensation of back pain. Now, we're going to talk about the major parts of the low back, beginning with the vertebra, the bony structure that actually encases the spinal cord. This bony structure normally begins as a very smooth structure, one stacked on top of the other, and you can have changes within this bone where the smooth edges become jagged and produce these little bony spikes, which can be a source of pain. In between each vertebra, you have an intervertebral disc. Basically, this adds flexibility to the spine, and this gelatinous structure can actually protrude in any direction if it gets overstressed. This is what you refer to as a herniated disc, and when a part of that structure protrudes out in a particular direction, it can actually impinge a nerve. So I want you to think of the intervertebral disc like a jelly donut. If you squeeze it from the front end, what end does the jelly come out from? The back. That means sometimes if you're bending forward a lot and you're trying to pick up many items off the floor, it can cause a disc herniation that pops out through the back that can actually impinge on a nerve, causing a numbness and tingling sensation down the leg. On top of the vertebrae and the intervertebral disc, we have tendons and ligaments. Now, a tendon connects a muscle to a bone, and sometimes if we overstrain ourselves, we can actually injure a muscle or a tendon, which can be a source of pain. Now, a ligament connects a bone to a bone, and it's meant to prevent you from flexing too much or extending your back too much. If we overstretch ourselves, we can introduce a tear into a ligament, or we can overstretch a ligament, and that can be another source of pain. Now, let's talk about the most important structure of the back, which includes the spinal cord and the nerves. I want you to think of the spinal cord as a tree, and I want you to think of the nerves as branches from that tree. So let's say I want to move my foot forward. There's an electrical signal that comes from my brain into my spinal cord, into my nerves, and into my foot saying move forward. That's called a motor nerve. Now let's say I step on a sharp pebble. There's an electrical signal that comes from my foot into my nerves, into my spinal cord, and back into my brain saying you stepped on something sharp. That's called a sensory nerve. Now these nerves have to come out from in between the bony structures that we call the vertebrae. And If there's ever any disturbance within the system, such as the bones impinging on these nerves, or any movement that we might do that puts pressure on these nerves, it can be a source of pain. It can cause numbness and tingling. It can cause a cold sensation. It can even cause a burning sensation that might travel down your leg and affect the way that you walk. So the reason to tell you of all these multiple structures in the back is to show you that the majority of back pain is due to a disruption in the way that the components in the back fit together and move. The good news is, low back pain is rarely caused by something that requires surgery. Routine x-rays are not recommended. First, it doesn't change the overall plan of what we would do for back pain. Secondly, it avoids unnecessary radiation exposure. Sometimes, just getting a routine x-ray doesn't actually pinpoint where your pain is coming from. Surgery is rarely needed. Surgery is only considered when there's a suspicion for cancer, spinal cord injury, spinal infection, severe or progressive neurologic abnormalities, or aortic aneurysms. Luckily, if you are here today, your doctor does not suspect any of these as a culprit for your back pain. Now, the important thing is to keep active and keep moving. Studies have shown that bed rest can actually worsen your back pain. People who have avoided bed rest had better flexibility than those who rested in the bed for a week. Normally, if you ever remember a time when you actually rested in a bed due to a flu or a cold or any other illness, you notice that when you get out of bed after laying down for several days, you become weak, you feel more stiff, you feel dizzy, you feel nauseated. All of this is because over-resting can actually be detrimental to the back health because structures stiffen and your muscles tend to weaken after resting for a long time. So today, in this class, we're going to talk about promoting proper body mechanics in order to keep your spine in alignment, and this, in effect, will help prevent further injury. So the best treatment for back pain is exercise. It does not increase the risk of injury, and it actually will help you get back to where you were before. Helps to improve flexibility, strength, and it actually results in improved pain ratings, which can by itself prevent further injury. So in this next segment, we will be covering posture, body mechanics with movement, and exercises you can do to help work towards a healthier spine.
Hello, my name is Kevin Sullivan, Physical Therapy Assistant at Zuckerberg, San Francisco General Hospital, and today I am here for you. We're going to go over the importance of sitting posture. Many of us have jobs nowadays that we're sitting much more than we used to. So let's begin. The first tip is, when you're sitting, don't sit too long. No one should sit really more than 20 or 30 minutes. Every 20 or 30 minutes, you should get up, move around, get the circulation flowing through your body, and this will help your lower back. Now, when you're going from a sitting to a standing position, there's some tips you may want to think about. The first one is, before you stand up, scoot to the edge of the chair. By doing this, you're going to be in a better position for your lower back to stand up. The second thing is, as you come forward, you're not going to use your back muscles when you stand up. You're going to use the hip muscles. So as I'm on the edge of the chair and I come forward, I squeeze my hip muscles and stand up nice and straight. The same thing when I'm sitting back down, I'm going to use those hip muscles. Let me show you from a different view. Same concept, scoot to the edge of the chair, and as I lean forward, my back is straight. I'm using the mobile hip joint to hip hinge as I come up and stand up straight. This is a great strategy for helping your lower back. Now, some other important tips for sitting. You need a chair that fits you. This chair that I'm at is a great chair because one reason is it's got a back support. So my back is supported as I'm sitting. The other thing is your feet should be touching the floor when you're sitting. Your feet should be grounded on the floor. If your feet are dangling in the air, that's putting a lot of stress on your lower back. Conversely, if you're really tall and your legs are too high, you need to raise the seat up a little bit. Another great tip is your knees should be slightly lower than your hips. By sitting in this position, you're decreasing the stress on the lower back. Other important tips, you can exercise your stomach and engage your core while you're sitting in your chair. To do this, you would just bring your belly button towards your spine, count 5, 1, 2, 3, 4, 5, and relax. This is a great exercise that can help your lower back. Another important tip is armrests. If you have a chair with armrests, you can do something called decompression of the spine, which can help your lower back. How do you do this? You simply just put your hands on the armrest, gently put some weight into your arms, and lift up slightly. And by doing this for about 5 seconds, you will decompress your spine and potentially lower your back pain. Other important tips, you can use a towel roll. Now, we know that sometimes there's situations where you're stuck in a chair. You may not be able to get out of the chair. You may be on a long car ride. What you could do is, to mitigate the situation, put a towel roll behind your back, and this will support your back and help you to sit up straight. These are some great and important tips that can help your back to heal and prevent it from getting injured in the future. Standing posture is an important component of protecting your lower back. So let's begin. As you're standing, one great tip to use is find a wall. Walls are free. It costs you nothing to stand up against a wall. And you can practice this tip in the morning, in the afternoon, and at night. And by doing this, you would get up against a wall, engage your stomach muscles. Don't lean back too much, but feel your back against the wall. Lift your chest up, pull in your stomach, 1, 2, 3, 4, 5. And by doing this tip, it's going to help you stand up straight throughout the day. The problem is many people are very straight up against the wall, and as soon as they come off, they collapse down. So you want to find more of that neutral spine. As you're sitting, you don't want to lean too far forward. You don't want to lean too far back as well. When you're leaning too far back, you end up hanging on your ligaments of your spine, and this can damage and injure your spine. It's better to engage your stomach and maintain more of a neutral posture. Other things about standing. Many of us have jobs that we have to stand for long periods of time. Simple things that you can do is lean on something and take some pressure off your back. And I'll show you one simple tip. If you had a table like this, you could lean forward like this, keep your back straight, hold this position, and relax your legs. Keep your legs loose and relaxed. Never lock your knees back. And by holding this position, I am tractioning my spine and taking pressure off my spine. When you're done with this, after a minute or so, make sure you use your arms to push yourself back up. These are some successful tips that can help protect your back and allow you to stand throughout the day without lower back pain. We're going to talk about the importance of protecting your back when you go to bed at night by taking a few minutes to set up pillows and towels to support your back and to try to keep your back relatively straight. You can get a better night's sleep and increase your probability of waking up with less back pain in the morning. The positions we're going to cover today are sleeping on your side, sleeping on your back, and also sleeping on your stomach. So let's begin. I'm going to take a pillow, and I'm also going to take a towel. And what we're going to do is we will put one towel here, and we'll start with the sideline position, and that will support our waist. Here, I've got a nice towel, and all I did was roll up this towel, and this works great as a neck support, and it allows your neck to stay in what is called neutral spine. You'll place your pillows here. This will be for your waist, and as you lay on your side, pillow between your legs. Now, this is a very comfortable position. My neck is supported, my pelvis and lower back are supported, and the pillow between my legs also helps to keep what we like to refer to as neutral spine. So this is a great position for side sleeping. The second position would be supine, sleeping on your back. For that, we recommend that you put a pillow under your knees. Now, if you have knee pain, or you had knee surgery, or you have any knee problems, we don't recommend putting anything under your knees. But if you're a back sleeper, by putting a pillow here under your legs, you're decreasing the pressure on your lower back. And this is a very comfortable position to sleep in. The third position would be sleeping on your stomach. And we typically don't like people sleeping on their stomach because it can add too much lower doses or curve in your back. But one way to mitigate this is to put a pillow under your stomach like this, and this will help decrease some of the excessive curve that can develop from sleeping on your stomach. Now, the other thing that's very important is moving in bed. For many of us, moving in bed can be problematic. So when you move in your bed, you want to think about having your shoulders and hips stacked. What does that mean? It means as you move, if your hips go one way, your shoulders will go that way. If I go to my right and my shoulder turns to my right, my hips go with my body. This way we avoid twisting in bed. And this brings us to the final part, how to get out of bed every day. All of us have to get out of bed every day. How many times a year do we get out of bed? You're right, over 300. And the best way to do it is called log rolling. And let's learn about that. Number one, as you're getting up, lay on your side. From this position, you're going to gently push your hand here, and as your hand pushes up, simultaneously, your legs will come over and off the bed, and you will almost sit up naturally with very little effort. This takes a lot of pressure off the lower back. And if you can do this on a regular basis, you can protect your back and get your day off to a great start.
Hi, my name is Felipe Cáceres, and I'm a staff physical therapist here at Zuckerberg San Francisco General Hospital. And today, I'm going to be covering body mechanics with movement. So, basically, any activity that requires movement, bending, straightening up, lifting or manipulating an object of any sort, you should always start by engaging your core. Now, what do I mean by engaging my core? What I mean is bringing your stomach in, kind of holding it in as you're performing the activity, because this helps to function as a back brace that helps you with any activity that you have to do throughout the day with a reduced risk of injury to your spine. Sometimes a lot of my patients ask me, why did I get back pain? I can't remember any particular event that happened that led to this injury, and little by little throughout the years, it's been getting worse. Sometimes it's the movements we don't pay attention to, the movements we perform 100 times a day, 1,000 times a week, 1,000,000 times throughout the span of a year that can lead to back pain. So let's take, for example, the simple task of washing dishes. Basically, a lot of people lock out their knees, they round their spine forward, they wash their dish, they twist, they wash the next dish, they twist. They do this about 100 times a day, and then they ask, why did I get back pain? Well, if we analyze that particular movement, you're relying on your ligaments to hold you up when you lock out your knees. When you round your spine forward, you're putting excessive pressure on the spine, and at the same time, you're not engaging your core. And you're twisting to one particular direction, which leads to an increased risk of injury. So, the way this task should be performed is by softening your knees, bringing your hips back, engaging your stomach, grabbing your dish, keeping it within your body here, washing your dish, turning, washing the next dish, turning, and completing your task in such a fashion. Basically, by doing that, it helps to prevent back injury or future back pain. Same thing, a task such as sweeping. A lot of people, same principles, they lock out their knees, they round their spine forward, they don't engage their core, and they twist too much in one direction. What I suggest is same principles as the washing the dishes. Soften your knees, hips back, stomach in, and basically performing your sweeping activities. This will help to prevent back pain, which is common household task. Now, changing a bed. A lot of people, when they change the bed, they do the same thing. They basically round their spine forward, they throw down their bed sheet, they reach all the way to the other side, effectively twisting their spine, and then they develop back pain by a simple activity such as changing a bed linen. So, what I suggest, the same principles, soft knees, hips back, engaging your core, keeping your arms within your side, putting your bed sheet, completing everything you have to do on this front end, then going to the other side and completing the task. So, this might take you a minute longer, but your back will thank you for it. Now, things that people have to perform at work or even in the house that include lifting heavy items. So, here comes the principle of hip hinging. You don't want to round forward when you pick up an item from the floor. You want to make sure that when you bend down, your legs are shoulder width apart, you bring your hips back, you engage your core, you pick up your item, and then you come up. So, you want to make sure that anything you manipulate, you're always protecting your spine. So, such as this medicine ball. Same principle, legs shoulder width apart, bringing your butt back, bringing the medicine ball here, looking straight forward, holding it here within your body's base of support, turning around, then placing it in the corresponding bin. The reason I'm emphasizing that hip hinge motion is because the spine is not made for excessive flexion. And sometimes those type of movements can be a source of back pain. Same thing, the most compressive forces occur when you pick up something heavy and you twist your spine, which can lead to injury. Now, on the other hand, the hip is made for a lot of motion. So you want to make sure you maintain your spine neutral, core engaged, and activate at the hips. So once again, for basic review, legs shoulder width apart, stomach in, hips back, grab your item, stand up, and put it where you need to place it. These are the basic principles of body mechanics that can help prevent back pain. It can actually help you heal if you already have a back injury. Now, we're going to cover the exercise component of this class and provide you with basic exercises that can help strengthen your core and can actually help promote improved spine health. So, the first exercise that we're covering is how to engage your core. So you're going to lie down with your feet bent like so. What you're going to do is you're just going to bring your stomach in, and you're just going to hold it for 5 seconds. 1, 2, 3, 4, 5. Let go. And as you bring your stomach in, you should feel it. You should feel your back press against the table itself. So once again, in. 1, 2, 3, 4, 5. Let go. That's 2. Again. 1, 2, 3, 4, 5. Let go. Keep on going. You got it. In. 1, 2, 3, 4, 5. Let go. And one more time. In. 1, 2, 3, 4, 5. Let go. One thing I want you to notice, when I bring my stomach in, I do not breathe in. I don't even breathe out. I disconnect this from my breath completely, and I just focus on these muscles going down into the table and feeling my back press against the table itself. And you can kind of feel this by putting your hands here behind your back and then bringing your stomach in. 1, 2, 3, 4, 5. Let go. And you want to do 3 sets of 10 of these with a 5-second hold for each one. When I say 3 sets of 10, what I mean is you do 10, take a minute break, 10 more, take a minute break, and another 10. Now, if this is a little bit too easy, what we're going to do is what's called a supine march while you're lying down. So what that means is you're bringing your stomach in, you're lifting up your leg, bringing it down, bringing up your other leg, bringing it down, bringing up your other leg, bringing it down, bringing up your other leg, bringing it down. All for a count of 10. And what this does, it helps you learn how to brace your abdomen when you're actually moving or lifting your legs. So now, next exercise. Sometimes people have a hard time bending down to pick something up because they have very tight hamstrings. And it's this long muscle that goes all the way from here, all the way to here. So, basically, what you want to do is you want to learn how to stretch your hamstrings in case those muscles are the thing that's preventing you from being able to bend down without rounding your back. So, what you do is, you grab a towel, bring up your leg, perpendicular to the ceiling, put it around your foot, and you pull. You just hold that for 30 seconds. So what I feel right now is a nice stretch from here to here. If you feel anything else, if you feel any numbness and tingling, hot, cold sensation, or any other kind of sensation traveling all the way down the leg, I would suggest not doing this exercise because it's harming other structures that you don't want to harm. all you should feel is a nice gentle pull from here to here. And not so much a pull, but more of a stretch. Next exercise is called a piriformis stretch. This exercise can also be something that can help alleviate pain and help also maintain a little bit more flexibility. What you do is you cross your leg over your other leg like so, and you just hold this for 30 seconds. If you're doing it correctly, you should feel a nice gentle stretch here in your gluteal area. If you feel anything else, such as a hot, cold, numbness or tingling sensation traveling down the leg, don't do this exercise. Now, for a lot of people, this exercise isn't causing any sensation whatsoever. So what you do is, you pull this leg up and then you relax into it. And you hold this for 30 seconds. And you should feel a nice, gentle stretch right along this area here. You would do this for 3 sets of 30-second holds, just maintaining that nice and gentle stretch. So now, what we're going to cover is exercises you can do when you're sitting. So here, this is a more milder exercise that you can do. Same principle. When you're sitting up, watching a movie, watching a show, what you do is you just bring in your stomach in, hold for 5, 1, 2, 3, 4, 5, let go. Once again, in, 1, 2, 3, 4, 5, let go. Doing this when you're sitting, watching a movie, or just relaxing is a good way to strengthen your core muscles without doing too much effort. So, same principle, 3 sets of 10, 5-second holds. And once again, for the stretching exercises I reviewed lying down, 3 sets, 30-second holds. This next exercise is a one that teaches you how to pick up things from the ground in a safe and controlled position. So, legs shoulder width apart, stomach in, hinging forward at the hips, standing up. Then once again, stomach in, hips back, sitting down. 1. Again, up and back. 2. Then again. 3. Same principles, 3 sets of 10, 10 repetitions, 1 minute break in between. This is a good way to give you the body mechanics to be able to bend down, pick up something from the floor, and come straight up. So these basic exercises are exercises you can do on a daily basis that help strengthen your core, help alleviate back pain, and just make you more flexible and more stronger in general so that you can do your daily activities with a reduced amount of pain. Medical disclaimer. The purpose of this class is to help you with general back pain. The principles and exercises covered in this class are intended to help you understand the back in order to prevent further injury and to possibly alleviate your symptoms in regards to back pain. However, if your symptoms are not improving, if your symptoms are getting worse, or if you develop any new symptoms, we recommend stopping the exercises provided in this class and speaking to your medical provider in order to further assess the situation.